And I have 3 boys with PANDAS.
They're preventing from doing so much that most 10-year-olds can do.
We all went through many traumatic experiences watching her in such anguish, deep psychological pain, or not being able to control her actions.
He started with a simple shoulder shrug a couple of times a day, which within 2 weeks had developed into full-on motor tics, vocal tics and compulsions.
The problem with washing her hands literally until they would bleed.
A wider range of symptoms, to the worst being suicidal.
But these symptoms never really improved, and in actual fact they have got worse to some extent as he's got older.
They tried to tell me possibly epilepsy, it could be Tourette's.
He was diagnosed with Tourette's.
She actually had a 19-week psychiatric inpatient assessment.
He sent Josh for his blood tests, which showed his strep levels were high, and he diagnosed PANDAS.
Very slightly, it's helped with school mainly because we've got a name for why he's got the symptoms that he's got.
We have limited support on the NHS.
And the NHS pulled funding and life continues to be a great struggle.
My daughter was started on an antibiotic, and within 3 days all of her symptoms were either gone or halved in severity.
We had no option but to seek help privately with the Children's E-Hospital.
It's also quite heartbreaking to see
Uncertainty.
We were quite worried at this time. It was quite a scary time.
It's very challenging.
An emotional roller coaster most days.
There's nothing soothing or habitual about the onset of this condition.
She woke and was unable to move around her room.